Can you talk a little bit about the location of the primary tumor? I have some people friends at stage 4 who have locations of their primary tumor are perhaps not in the best places, which makes surgery riskier. Can you talk a little bit about that?
Yeah, absolutely. So when we think of lung surgery, again, the goal is to get out all of the tumor. I would say the most common lung surgery that's done is a lobectomy. Again, there are 3 lobes on the right side, there are 2 lobes on the left side. In order to do a lobectomy, most of the time we're able to do it with small incisions in a minimally invasive fashion. Here, I use the robot a lot, but there are surgeons who use the robot, surgeons who don't use the robot, and the non-robotic way is called VATS. And in terms of the size of the surgery, a lobectomy is an anatomic operation. You literally do all of the dissection so you can expose the arteries that feed the lobe, the veins that feed the lobe or vein, and then the airway that feeds the lobe. And that's tedious. That's where we really get into the stickiness that we were talking about before, because when you're dissecting on those areas, that's oftentimes where the cancer cells and or the lymph nodes are that have had such a robust response to treatment. And so if I can safely do a lobectomy for somebody with stage 4 disease, or sometimes even less than a lobectomy, meaning a segmentectomy where I take an anatomic piece of the lobe pie, or maybe even a wedge resection where I don't do all of the dissection on the structures and I just take a normal swath of tissue around where the nodule or tumor is. Those are things that I think are good operations for stage 4 disease.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.